President Obama's health care reform, one doctor is taking a personal stand. She is quitting the American Medical Association after being a member for 30 years to protest the group's support of the bill.
Yeah, Dr. Elizabeth Vliet joins us now to talk about it. Good morning to you, Doctor.
Good morning. How are you this morning?
We are doing well. Thanks for joining us this morning. So you believe the AMA has sold out doctors. Why did you quit the AMA?
Well, most importantly, I feel that the AMA has always said that they stood for preventing third-party interference in the doctor-patient relationship, and that has been our ethical guideline, and this health plan does the opposite of that. The government is intruding with mandates on end-of-life counseling beginning at age 65. It's dictating guidelines for treatment. It's telling doctors that we must use comparative effectiveness research, which is basically code for limiting care based on age. And in the stimulus bill, which many people don't know, the electronic medical records requirement meant that all physicians by 2014 would have to send patients' electronic medical records directly to the federal health czar without the patient's permission. And I don't think most people realize that such privacy is at stake, and I see that as a violation of our Hippocratic Oath and the AMA standards, and I'm shocked that they're supporting it.
Dr. Vliet, I see that as a very scary practice. The AMA has this to say, quote, yes. We support passage of H.R. 3200 and we look forward to additional constructive dialogue as the long process of passing a health reform bill continues. We are committed to passing health reform this year consistent with principles of pluralism. All right, the quote goes on, but on their website, the AMA says their vision is to help doctors help patients. To you, what is the end result? What are the negative effects of this health care plan for the patient and for the doctors?
Well, I think patients are being grossly violated in their privacy, in their ability to determine for themselves their end-of-life plans, their treatment options, and to be told that as you get older and sicker, the government is going to mandate federal counselors to meet with you to encourage you to decide to go into hospice, I think is appalling. And I wonder if many of the AMA executives have actually read what's in the bill. You know, we see evidence that our legislators are not.
Right. Oh, we know that. As big as it is, most people haven't read it. Well, look, I mean, conservatives and liberals agree that the health care system is broken. Something needs to be fixed. You know, health care premiums doubling in the past decade. As a doctor, what do you think is the right response for health care in this country?
Well, you know, I think there have been some excellent programs and ideas suggested. The minority party has a number of amendments that we don't even get to hear about because the bill is being rammed through. And Safeway has an excellent model that has worked extremely well. Patients are happy with it, costs are down, and people are incentivized for taking personal responsibility in their health. And I think those are all laudable goals. And I listened to a number of amendments that the minority party is proposing, and none of these are coming out.
Yeah, we're not going to hear any of them.
That's
Dr.
right.
Elizabeth Vliet,
and I think
we got to leave it there. Unfortunately, we're out of time, and hopefully we'll hear some of these amendments. Doctor, thanks so much for joining us this morning.
You're very welcome.
Appreciate it. Coming up, Cambridge.